Hi, this is Dr. Stoker in Los Angeles with an interesting case. We have a woman who's 46 years old, lost almost 100 pounds through diet and exercise, and she flew all the way from the East Coast for me to perform stage 1 of a reconstruction, which is going to be a circumferential lower body lift. The idea being to get rid of all the extra skin on her torso and on her thighs, and we're going to do that with an incision that's hidden right where her bikini is going to be. And we want to make her comfortable wearing a bikini. You can see there's quite a bit of laxity back here in this skin. It drives her nuts. This is a large part of the reason why that she's here. What we're going to do is lift and simulate. I'm going to simulate for you the amount of lift that we're going to be able to get, something like this, to really tighten and smooth that area out. We're not going to take away any fat. I want to preserve that because, as you can see, when we turn the side here, she's quite flat in this area. So what I'm going to do is when I remove a strip of skin around her waist, I'm then going to overlap that fat so that we give her a little bit of a bump back here that she otherwise wouldn't have. And if I simulate from the side view, you can see a little bit about how that's going to appear when we tighten things up. We're going to tighten her rectus abdominis muscles here with this diastasis that she's got. And then if we turn her to the front, let me go ahead and turn. We're going to not only take down all of this extra skin here and get rid of this laxity, but we're going to lift and tighten and smooth her anterior thighs and the pubic area and the vulva and labia majora as well. It's all going to make an enormous difference for her. I'm super excited that she's now at her ideal weight, a perfect candidate for this operation, and I know how to do it. Hey guys, Dr. Stoker here in Los Angeles with a really beautiful result approximately 2 weeks post-op. This patient is about 46 years old. She lost a huge amount of weight through diet and exercise, flew out from the East Coast for me to do a circumferential body lift that included a buttocks lift, lateral thigh lift, abdominoplasty, and pubic lift. And in my opinion, we have a breathtakingly spectacular result here. She's got gorgeous curves, complete resolution of the lines of laxity that she had back here in the cellulite, and the folds of skin. The incision is perfectly located so that she can wear a little tiny thong bikini now. When you look at the before and afters, you'll see how unthinkable that was for her just a couple weeks ago. If we rotate her around here, we see that even despite having a little bit of swelling because she's healing up, it looks incredible. Got gorgeous curves in the front here. The incisions, again, nicely healed down here. So you got a little bit of ointment in the belly button, which is healing nicely. And you see that it tightened up the anterior thighs, the inner thighs. You can't see it, but it totally tightened up the pubic area, the mons pubis, the labia majora, even the labia minora got a little bit tighter on this, which is to say that this is a big-time operation. We removed approximately that much vertical height of skin on her, and she's not that big of a person. It's almost like her skin had sagged, like her pants were down around her mid-thighs. We removed everything in between and pulled them back up where they belonged. This is the figure that she was always meant to have, and I know that she's feeling right now like this was a spectacular decision for her to fly out to Los Angeles to do this operation.